Kia ora, my name is Emily, and today we are discussing breaking the silence, group discussions, social pressure, and the adoption of health technologies. Our work has been done in conjunction with the University of Munich and Reemi, a social enterprise focused on innovative menstrual products and education. The work has been funded by ALRA through the Humanitarian Innovation Fund, and we want to say a huge thank you for their support. Good menstrual hygiene management contributes to the physical and mental well-being of women and improves their economic prospects by reducing obstacles to school and work. Yet maintaining menstrual hygiene continues to be a challenge in many developing countries, and waste disposal continues to be a major issue. A key factor inhibiting sustainable improvements are restrictive social constraints, stigma, taboo, and social norms. We wanted to explore the effect of social pressure and stigma on technology adoption, in particular in the setting of menstrual health management in Bangladesh, and test a zero-waste solution for this constraint. An interesting query in the context of menstrual health management is that solutions such as sanitary pads are already widely available right now, and yet they're not widely adopted. After 2 years of research with local partners understanding MHM challenges, we co-created antibacterial period underwear with our Bangladeshi teams. We then looked at this question by conducting a field experiment with 476 female workers in a Bangladeshi garment factory. Around half of these women received our treatment in this randomized control trial. The treatment consisted of a 1-hour facilitated discussion session where the women were split into groups of 15 to 20 people to openly discuss menstruation and the experiences that they may have. Our primary outcomes were, first of all, willingness to pay for sanitary pads, and second, the pickup rates of the period underwear. Now, both of these products had to be picked up on the factory premises in a small convenience store run by a male shopkeeper. And so our hypothesis is that after the 1-hour discussion amongst each other, these women will be bothered less by potentially being observed by colleagues when they pick up the product, and also be worried less about talking to a male shopkeeper, because they will feel that the stigma and social norms around this topic are actually lower than they thought. And to look at the mechanism in more detail, we also have explicit measures for social norms, stigma, and taboos. We used incentivized methods to measure the valuation of the products, like a willingness to pay activity. Our metrics are incentivized and therefore mimic market conditions. What we found is that indeed our treatment was successful in increasing the willingness to pay for sanitary pads by more than 25%. Goes up from 91 Bangladeshi taka to 114 Bangladeshi taka. And we increased the pickup rates of the period underwear by more than 10 percentage points, from around 71 to 81% of the women picking up this product. Take note that 71% uptake full control actually shows a remarkable demand for this new product. We also observed after 6 months, only around 25% of women were still using cloth, down from 50%. Pad use increased from 60 to 70%, and around 70% of women reported still using the period underwear after 6 months. Using the Net Promoter Score, we could see high favorability with an average of 58. This is a remarkable figure as the NPS scoring system is based on the need to share and discuss the product with colleagues. Lastly, through our explicit measures for stigma and taboo, we saw a reduction on perceived social constraints of 50%. The main takeaway is that our work dived deep into the demand and desirability of our zero-waste products. This is particularly important when it comes to aid distribution and the uptake of period products that are given out. Our insights with the garment worker community have enabled us to understand the demand for and barriers to MHM in a population that has some purchasing power, but in the most restrictive settings. Our hope is that these learnings can be instrumental in breaking the silence around MHM, and we should expect to see higher adoption rates in less stigmatized communities. Today, you are learning about one piece of our research. We also created other MHM products, and our entire work with ALRA consisted of 3 pilots across more than 700 workers. We encourage you to read our working paper and find out more at reemi.org/research. Also, feel free to get in touch if you want to trial some of your products in your settings. Thank you for your time and hope you enjoyed this 5-minute espresso slot.